So this town hall is a digital town hall with women of color, congressional leaders, and grassroots activists from across the country. We at the Congressional Progressive Caucus Center are partnering tonight with the amazing She the People, and Aimee Allison is there with her awesome background in the back, Color of Change, Climate Justice Alliance, the Communications Workers of America, People's Action, and Community Change Action. This really stellar group of folks has gotten together tonight to shine a light on the way in which the coronavirus is affecting communities of color who are being hit the hardest in this pandemic, and we're so grateful to you for doing that. So the Dispatch from the Frontlines is a weekly series that we put on here at the Congressional Progressive Caucus Center. And we're holding this series to highlight the working people on the front lines of the coronavirus crisis and the work of progressive champions in Congress who are fighting to put people first in this recovery. For those of you turning in for the first time, I'm Liz Watson. I am the Executive Director of the Congressional Progressive Caucus Center. We're a nonprofit organization dedicated to building power for the rest of us. That means we work to build cohesion across the progressive movement to educate the public and policymakers about cutting-edge progressive policy ideas that build power for working people. We work with grassroots leaders, advocates, labor unions, organizers, researchers, and policy experts in the public. So tonight we're doing things a little bit differently, and I'm so excited about our format tonight. In particular, I am just thrilled to be joined here by Congresswoman Judy Chu, Congresswoman Ayanna Pressley, and I think in a moment we will be joined by Congresswoman Barbara Lee. We are really honored to have you with us and excited to hear from you. We're honored to collaborate in this effort with She the People, and as you heard, all of our other wonderful partners who are on this call tonight to talk about this special conversation about how the coronavirus pandemic is deeply affecting communities of color. And in just a moment, I'll hand the floor over to my friend Aimee Allison from She the People to moderate the conversation. From heinous attacks on Asian Americans to shocking death rates among African Americans and Latinos, to the fact that women of color are disproportionately working on the front lines in essential jobs without living wages, without personal protective equipment, without sick days. It's clear that while we are all experiencing this crisis, it is not affecting us all equally. In COVID-19, as in so many aspects of life, structural racism means that communities of color are bearing the brunt of this pandemic. And we're going to learn more about that tonight and about the policy solutions that ensure that communities of color and the response to this crisis centers communities of color. You'll hear from Alan Barber, our policy director, a bit later in this call about some of the policy solutions that would ensure the needs of communities of color are put front and center in our response to the coronavirus crisis. And with that, I am so happy to turn the microphone over to my friend, Aimee Allison, to lead us in our conversation tonight. Take it away, Aimee.
Thanks so much, Liz, and thank you to the Congressional Progressive Caucus Center for your incredible partnership and leadership during this crisis. My name's Aimee Allison. I'm president of She the People. Very honored to be with you tonight. And I just wanted to start out the conversation with a moment to honor the life of 5-year-old Skylar Herbert, the daughter of first responders, firefighter, and police officer. Skylar died yesterday of coronavirus complications in Detroit, and at 5 years old was the youngest victim in America to fall victim to this virus and this disease. Skylar was at the beginning of her life, and she was a little Black girl. And so just a moment of prayer for the family of Skylar Herbert tonight. Our organizations came together to host this town hall because, as Liz said, it's clear that COVID-19 is not a great equalizer. The pandemic's hitting communities of color much, much harder. In addition to the heartbreaking stories, the data shows that our Black communities are contracting and dying of the coronavirus at alarming alarmingly higher rates. A third of the hospitalized patients from the coronavirus are Black, even though we Black people are only 13% of the population. And look at Louisiana, where a third of the population is Black. 70% of the people who have fallen to coronavirus are Black. Lack of healthcare access is just one of the reasons we've been hit hard, and we're going to hear more about the reasons and possible solutions tonight. And speaking of other communities, the Native American community are contracting and dying of the coronavirus at disproportionate rates. In the state of Arizona, 16% of the deaths from coronavirus are Native American, even though that community is 4.6% of the population. Now, our communities of color are the front lines of the crisis. There are essential workers, grocery store clerks, healthcare workers, farm workers, service workers, food service workers, delivering our food. 84% of Latinos in this country do not have a job that allows them to work at home. Low-wage workers putting their lives at risk, oftentimes without personal protective equipment and without paid sick leave or employer-sponsored healthcare insurance, leaving them even more vulnerable. It means that that this community is more likely to contract coronavirus than suffer more from it afterwards. And even further, immigrant communities have to continue to be in fear of being targeted and rounded up in ICE, and the fear of being thrown into crowded detention centers where coronavirus runs rampant. Right now, 40,000 immigrants currently sit in ICE detention centers without access to soap or basic health care. And then the Asian American community are being blamed and targeted in this pandemic. The group Stop AAPI Hate received over 1,100 reports of hate crimes against Asian Americans because of the coronavirus within the first 2 weeks. In Texas, a man stabbed an Asian American family. In New York, an Asian American woman was attacked as she went out of her house. And this is the kind of attacks that we're seeing, the kind of suffering that we're seeing. This is what the communities of color are suffering from at this moment. So we have come together as leaders of organizations and as organizers on the ground to talk with and for those who are most impacted by coronavirus 19. And as the congressional leaders you'll hear from today, have an honest conversation about the disproportionate impact the coronavirus has on our communities and what the relief package this week and in upcoming weeks needs to include, what we can do about it. So before we get started, I wanted to just acknowledge and thank Doreen Warren, President of the Center for Community Change, for being a part of this. We're going to hear from you and how we, at the end of this conversation, can take our knowledge and action and join in being a solution. And then I want to welcome to the conversation our fantastic leaders, Congresswoman Judy Chu, Congresswoman Ayanna Pressley, and Congresswoman Barbara Lee. Thank you all for joining us today. I wanted to begin with you, Congresswoman Chu. What are you seeing? What is the latest? And what are you looking for in the relief package that's being considered this week?
Well, communities of color are clearly some of the ones most impacted by the virus because they are some of the people deemed most essential. Communities of color are disproportionately represented in fields like healthcare, grocery stores, and transportation, meaning they're putting themselves at risk for our sake. But these same communities are also some of the most vulnerable. For instance, 29,000 dreamers work in healthcare alone, but their future in this country, unless their work authorization is extended, is still uncertain. And we need to make sure that we are supporting the most vulnerable of our workers. And the very least the government should be doing is ensuring that all COVID-19 resources and materials are translated into multiple languages so that everyone can access them, which is what I pressed the administration to do this month. And we also need to make sure that we're getting the appropriate resources where they need to be. For instance, with testing, and unfortunately, this is one of the biggest disparities for minority communities. Testing is key to getting us to the other side of this crisis. If we don't know who's infected, we cannot stop the spread of the virus. But the US is facing a severe shortage of testing nationwide. And as a result, our cases of COVID-19 in our communities are being undercounted, hiding not only the harm, but also the need. And that is why one of my top priorities in the next relief package, even beyond the one that we will pass this week, is to ensure that we can ramp up our testing capacity on a massive scale. Already we're seeing discrepancies on who can be tested, with reports of the wealthiest individuals being able to access them, whereas everyday Americans who are exposed being unable to get a test unless they are hospitalized. And then there's the issue of recovery. If we do contacting in order to really overcome the pandemic, there will be the necessity to quarantine. But in our minority communities, there is not the separate rooms that can allow for that quarantining. And we have to have ways of making sure that people can recover in our lowest income minority communities. Finally, let me say on hate crime issues, the AAPI community is indeed dealing with a horrendous rise in hate crimes. Actually, the AAPI websites altogether have documented 1,600 hate crimes and incidents since the start of all of this, including in New York, where a woman was taking out her garbage and then a man poured acid on her, causing chemical burns to her face and hands. And yes, in Texas, there was the family of 3 that was stabbed by a man who wanted to kill Asian Americans. And one of the kids that was stabbed was 2 years old. And an elderly man in San Francisco was simply collecting cans when a bunch of people verbally assaulted him and then physically attacked him. And in Los Angeles, a 16-year-old was bullied enough so that he was put in the hospital by those who accused him of having coronavirus. So we are educating people about these hate crimes. We're asking that people engage in bystander interventions if they see them, and that they know that these attempts to blame Asian Americans for coronavirus are wrong, and that we cannot get through this unless we are all united and unless we all help one another get through this.
And I was thinking, Congresswoman Pressley, it's largely because of your advocacy that the CDC finally agreed to release racial and ethnic data on COVID-19 cases, hospitalizations, and death, but we know it's not enough. Can you talk about what you're looking for in this week's package, what needs to be addressed?
Sure, thank you, Aimee, thank you, Liz. Thank you to my sister in service, Representative Chu. I'll just start with some sort of broad frame remarks, and then I look forward to getting into the Q&A, and I can unpack more of what I've been fighting for to date and will continue to fight for in the upcoming relief packages. But first, I just want to take a moment just to say that, while we are physically distancing and doing our part to protect the health and safety of our frontline workforce, it is so important that we stay close in our organizing, and that we continue to build community and to support each other, and that we don't allow this pandemic to hinder our mobilizing and our shared pursuit of a fairer and more just and equitable world. And it's also so important that while we're physically distancing, that we're not socially isolating. And so it is just a blessing to be able to be in virtual community with all of you. And it has been the high honor of my life to be a sister in solidarity in these pursuits with all of you. So thank you for the role that you play. Respectfully, respectively as table shakers and justice seekers and citizen activists, and again, so humbled and grateful for the leadership and the sisterhood of Representative Chu and Representative Lee. Your partnership and accountability in these unprecedented times is critically important. Our fight in Congress will only be as effective as the will of the people, and we need you all behind us. History has shown us that our most vulnerable communities disproportionately bear the brunt of all of our nation's biggest crises, in large part because the federal government has consistently and historically left so many of its people behind. This pandemic has exposed these painful truths, but it didn't create it. It has exposed these painful truths and these inequities about the impact of that failure. Black and brown communities are disproportionately facing higher rates of COVID-19 infection and death because our society has failed to ensure that all of its people have adequate access to healthcare, decent jobs and living wages, clean air, clean water, safe and stable homes. Just imagine how different our response would have been if we already had universal healthcare. A system that centered the dignity and humanity of people regardless of income or immigration status. How different our response would have been if we had universal paid leave and sick days that would have supported our frontline essential workers, predominantly women, predominantly Black and Latinx and immigrants, so that they can care for their families during this crisis and stay home if they feel sick. These are the consequences, this moment, of the failures of generations of intentional policy. Policies that were intended to abandon our most vulnerable in times of crisis. Let me be clear, I have no doubt that we will weather this storm. We will get through this pandemic. We will, and we will do it together, but simply making it through is not good enough. This moment does demand more. There is no going back to normal, and I don't want anyone to say that because it's that normal that was insufficient to begin with. We have the responsibility to reject a normal that fails to provide adequate health care to all people, a normal that abandons our most vulnerable, our immigrant neighbors, those experiencing homelessness, those behind the wall and in immigrant detention, Black and brown communities, and the disability community. So it is not enough to go back to normal. It is not enough to tinker around the edges. We have to be even more bold in this moment. We need a compassionate response that recognizes that our nation's greatest wealth is the health of our people. And we need a response driven and informed by data and focused on prioritizing our communities most impacted. Now, none of this is impossible. And Aimee, I thank you for referencing my sounding the alarm and banging the drum on this issue very early. Weeks ago, I joined my sisters in arms, Representative Lee, Kelly, and Bass, and Senator Warren, in calling for the collection of racial and ethnic disparities in COVID-19. And to be clear, this is not data mining for data mining's sake. It's not the collection and the disaggregation, the public reporting of data so that we can lament that the data is bearing out what we already know. The reason why we need the data is because it will save lives. We already know that these communities, that our communities have unequal access to healthcare. We already know the comorbidities of structural racism and all those underlying conditions, and that we represent most of the essential workforces. We need the data to directly inform where the resources go so that we can get ahead of this, because right now we are in the unenviable, unconscionable, and completely preventable position of being behind. And that is the last position you want to be in a pandemic. So we called early for Secretary Azar, Secretary of Health and Human Services, to begin to collect racial and ethnic data in real time, to disaggregate it, to report it. We wanted to make sure that there was equitable access to testing and treatment. We wanted to know where there were clusters and trends emerging. And so 30 states were already collecting some semblance of data, mostly age and gender. Then there were 3 states, Louisiana, Michigan, and Massachusetts, that were sharing collecting and sharing race data. And again, it confirmed our worst fears. So after that letter, we introduced legislation to keep pressure up on the administration. Almost 100 of our colleagues have signed on to that legislation. And again, just last week, the CDC announced that it would begin collecting and releasing the data. And this is a great step in the right direction. However, we want our bill endorsed wholesale, the Equitable Data Collection and Disclosure on COVID-19 Act, because we have to make sure that that data is married with resources. So again, I'm proud to be in this fight with my sisters in arms, and thank you all for what you do each and every day, and I look forward to your questions.
Thank you so much. Congresswoman Barbara Lee has just joined us, and really the question, just to start this conversation, Congresswoman, is what are you watching? What are the greatest needs for communities of color, and what do you want to see in the stimulus package being considered this week? And while we're working out some technical...
Can you hear me? Aimee,
we can hear you. All right, we've got
you. Well, listen, thank you so much. Sorry about this. We've been trying to negotiate this next emergency package, so I'm sorry I'm late, but that's what we've been trying to do in terms of trying to make sure that the $25 billion in the testing has some direct language that directs this $25 billion into communities of color and communities that have been most impacted, and that's of course Black and brown communities. So I'll just start there and say thank you so much for this, and to my two sisters, Congresswoman Chu and Congresswoman Pressley, thank you for your leadership. You all are staying the course. These are extraordinary, dangerous times, and we have a pandemic upon pandemic, and my two colleagues, my two sisters on every front are leading the way. We, on the data collection piece, Congresswoman Pressley has just been a young woman on this, and we're trying to hit this from all fronts and trying to get some of the data requirements and language into all of these bills as they move, and that includes this emergency bill as well as CARES 2, and of course passing the bill is extremely important because we need this codified into law immediately. So a couple of things we're trying to do as it relates to being a member of the Appropriations Committee and on steering and policy, trying to make sure that we have rapid response testing that's accurate, that's focused and targeted where the disparities are the greatest, of course, and that's in Black and brown communities. We want also to make sure that we provide funding for community-based organizations and faith-based organizations to provide the health education, because so much and so many of our communities and so much misinformation is out there. And so we're trying to get resources for these organizations who, of course, are trusted in our community so that they can begin to do the work that has to be done to try to stop this pandemic and these disproportionate rates of transmission and death. So we're trying to do that in this bill also, and we're trying to, again, direct language in terms of $25 billion for mobile units, community health centers, and focused rapid response testing. We also now are trying to get priorities to ensure that frontline workers, essential workers, that definition, as you know, states now decide who's an essential worker. Well, we say letter carriers are essential workers, grocery workers are essential workers, everyone who's on the front line. And I just have to give a shout out to all of our essential workers who are on this call and thank them so much for their sacrifices and for being there to protect the public health and in many ways in a very dangerous situation. And so we want to make sure that there are resources in the bill to ensure that essential workers and a broader definition of essential workers is there. We're also trying to enact a rent and mortgage moratorium and fund housing assistance to protect families from going into debt. We're trying to work on health care coverage and assistance at no out-of-pocket cost to everyone, including immigrant families, people with disabilities, people experiencing homelessness, and more. We're trying to provide more resources, and we have legislation to provide cash assistance payments for everyone for the duration of this crisis. We're saying, some of us are at least saying through a bill that some of us are on at least $2,000 a month for the duration of this crisis. At least, that's minimal. Also, full student debt cancellation And we want to increase funding for at-home and early voting and vote by mail so that no one has to risk their life to exercise their right to vote. And we're trying to make sure that the federal bailout funding goes to workers and to essential workers, to healthcare workers, to everyone on the front lines, to those who are unemployed, to the most vulnerable, not the CEOs. And so we're trying to tighten up on the transparency and accountability provisions of these bills, recognizing this administration is lawless in many respects. You heard what Trump said about figuring out ways to get around what we wrote into the first bill. So just know that we're very adamant about these provisions as it relates to most vulnerable people, poor people, low-income people, Black and brown communities and people. And we are not resting until we see this included in the federal laws and the federal appropriations that we're passing. So thank you again very much. Thanks to everybody for really adhering to the physical distancing. Coming from California, thank goodness my mayor across the bay, Mayor London Breed, actually was the first to come out calling for a state of emergency and social and physical distancing. And it's beginning to work. We're not out of the woods in California yet, but it's beginning. We're beginning to see some light at the end of the tunnel, but we have to stay within the healthcare guidelines and not move so fast to say this is over. It's okay to stop the healthcare protocols that have been established. Thank you so much.
Allison, you're muted.
That's a long and very, very powerful list of prescriptions in order to address the pain that communities of color are currently facing. I want to turn to Alan Barber, Policy Director at the Congressional Progressive Center, to give us a quick update on the new relief policies that are impacting our communities and what to look for next. We heard a lot of these ideas, the things that our Congress members are trying to get done in the Progressive Caucus. Alan, what are the possibilities for this next relief package? What's the actual package that's before Congress include?
Thanks, Amy, and thanks to everyone on this call for all the work that you do on the front lines, with the grassroots, in the halls of Congress, and just trying to support your families and each other emotionally and otherwise during this crisis. I'm Alan Barber with the CPC Center, and I'm just going to give you a quick overview of some of the policies we need in the fourth package to address needs of Black and brown people in the face of this pandemic. As Rep. Lee just stated, negotiations are going on right now on this next interim package. In addition to the rapid response testing and other items that she mentioned, one of the things on the table is additional funding for small businesses. In theory, this would be a much needed lifeline for small businesses, in particular Black and brown businesses, businesses owned by Black and brown business owners. But a lot of us have had difficulties accessing this tranche of loans in the first place. And on top of that, many multi-million-dollar companies swooped in like vultures to get their hands on these loans. And in fact, they received most of the money. To remedy this, there are some proposals out suggesting that we should demand at least 50% of any additional funding to minority-led companies, with $10 billion specifically going to firms with less than 10 employees. But as we've heard, the policy response shouldn't end with aid to businesses. Such a response would be disastrous. Just under 4 million people had lost their jobs at the time of the passage of the CARES Act. Since then, more than 17 million more people have filed for unemployment. And while we don't know the exact demographic breakdown of those people who have lost their jobs, it's safe to assume that people of color will disproportionately be impacted. Even in good times, Black unemployment is almost 2 times that of whites. And with some estimates suggesting that overall unemployment rates could already be as high as 15 to 20%, for people of color, that number is likely to be much, much higher. The expansions to unemployment insurance that we saw in the CARES Act are a great help to many workers. But unfortunately, a lot of these folks lost health insurance too, and many other work-related benefits. We need policies to make sure that any companies receiving funds are keeping workers on staff or rehiring them. Policies like those in the Paycheck Guarantee Act and other payroll guarantees, like stronger work sharing proposals. These would keep people attached to their jobs with benefits, receiving a paycheck, and importantly, staying home and social distancing. And under these proposals, when it's time for America to reopen, businesses could quickly bring workers back and get the economy moving again. And on the other side of the coin, we have to think about the workers that we depend on during these times, those essential frontline workers that we've discussed many times tonight. Black and brown people, Black and brown women in particular, are a large share of this new essential workforce. The bus drivers that get workers to work, the fast food workers still clocking in every day, the nurses keeping us alive, the Instacart workers delivering our groceries, the cashiers checking them out, and the truck drivers that are keeping the supply chains going. We need policies that mandate adequate protective gear for all of these workers. We need hazard pay. We need schedules that allow them time to rest and recover from taxing shifts and to care for themselves and their families. And finally, to address some of the long-term structural problems exposed by this crisis, we should strengthen laws and increase funding around voting to make sure that the voice of the people can be heard at the ballot box. According to President Trump himself, if we had vote by mail, you'd never see a Republican elected again. Structural imbalances such as access to voting places, being able to take time off to vote, and others make it harder for people of color and the most vulnerable among us to participate on election day. The list of ways that we could strengthen the policy response to the coronavirus could go on, and a number of people are going to discuss some of those other policy paths tonight. But for now, I'm going to give my time back to Aimee and the rest of the speakers. Thanks.
Thanks so much, Alan. Again, if you're just joining us, this is a very important discussion on the impact of COVID-19 on Black and brown communities. We have Representatives Barbara Lee, Ayanna Pressley, and Judy Chu with us, as well as organizers in some of the organizations across the country who are working to make sure that some of the solutions that Alan just laid out in terms of legislative solutions get actually put in place. I'm going to go to Salah Muhammad, a small business owner and member of Color of Change. If you don't mind, introduce yourself and tell a little bit more about your story before your question.
Thank you so much. And thank you for the Congresswoman for joining this discussion. I think this is really incredible for our communities. Like Aimee said, I'm an entrepreneur, writer, podcaster from Philadelphia. And a member of Color of Change, the largest online racial justice platform in the country. Black communities like mine have been disproportionately impacted by this pandemic. We're dying more than anyone else. Black people make up more than 30% of the people who died nationally. And here in Pennsylvania, a scary 52%. We're disproportionately represented in the essential fields. So those of us that are still employed are at higher risk. I'm also a father, and many Black students also don't have the resources they need to continue schooling. So homeschooling or for our communities are another huge disadvantage. Like so many people in my community, I've been out of work since March 13th and have been social distancing with my wife and kids. But the funding for small businesses has dried up in less than 2 weeks. Black business owners like myself, we weren't able to access that same funding before it dried up. My question is for Congresswoman Pressley. What is Congress doing to help Black families, Black communities like mine that are disproportionately impacted by COVID-19? And what can we do as a community to keep our people alive?
So I can tell you, what I've been championing, and many of my progressive colleagues and my colleagues in the Congressional Black Caucus, specifically what I've been fighting for and will continue to fight for. Again, the race data, that information is so critical. It is encouraging the CDC. I mean, I sent that letter in mid-March. We did not hear back from HHS until several days ago, and that was a public response with the announcement that the CDC would begin collecting, disaggregating, and publicly sharing the data. But again, if the data is not married to resources, as I said, we are behind in this pandemic. We need to get ahead of it. So that means contact tracing, that means mobile units, that means a greater infusion of federal funds into our community health centers so that they can be testing sites. It means providing that alternative housing for many of our families, as Representative Chu was mentioning earlier, who are in such close quarters that if they are displaying symptoms, they cannot physically distance or quarantine. And so providing that alternative housing. So the race data collection is so critical because I need the resources. We need the resources to follow the data. It lets us know where there are emerging trends, where there are clusters, where there are hotspots. And again, it shines a light on whether or not, from a public health response, our access to testing and treatment is equitable. So that's the number one thing that I'm working on to keep Black folks alive. The second thing, as I said, is our community health centers. I represent a district that's 53% people of color, 40% foreign born, almost 40% single female headed households. 1 in 3 of my constituents receive their health care from a community health center. So when we talk about the public health response, we know that our health centers, they provide culturally competent care, accessible care for our most vulnerable, low-income communities, the undocumented, the uninsured communities of color. So continue to fight for our community health centers. When it comes to the economic recovery, to the presentation that was just offered. And again, none of this is surprising. We know that we historically, Black businesses, minority businesses face many structural barriers in accessing capital and things like that. And so I'm pushing for the same transparency, and many of my colleagues in financial services are joining me in that call, that we see transparency from Treasury in terms of who's accessing PPP, and that we make sure that those that are eligible are those businesses that are too small to fail, our beauty salons, our barbershops, our bodegas, our restaurants. It's been very frustrating, infuriating, and unjust that the feds kept changing guidance on the back end. So one, the lenders are not diverse enough. It's just the big banks. They tapped out early and they'll only operate with those that have existing accounts. It was first come, first serve. And then they said, if you have a criminal record, you're ineligible, when 1 in 3 Americans have some sort of criminal record. And so just insisting that there be that transparency, that fair lending, and that equity. And again, we need the data and the transparency to drive that. The other thing that I'll just end here is student debt cancellation. Black students, we are the biggest borrowers, and we also, Black and Latinx students, we're the biggest borrowers, and we also represent the highest percentage of defaults. The average borrower is saddled with about $30,000 worth of debt. And I know that folks like to make this a millennial issue, but I'm 46. I have plenty of friends that still own their student loans. There are seniors whose benefits and others whose wages have been involuntarily garnished because of the funds that they owe. And so I don't see how we have any sort of comprehensive economic recovery without student debt cancellation as a way to put money back in people's pockets. And I'm going to continue to fight for more direct cash assistance. Let me just say that. Only Secretary Mnuchin and the people that he keeps company with think that anyone can live off of $1,200 for 10 weeks. That's not enough. And just to speak to the impact of this corporate bailout, we need a people's bailout. There are some projections that said that if we had not bailed out those big businesses and those corporations, we could have given everyone $13,000, not just a one-time cash infusion of $1,200. So I'm going to continue to fight for more direct cash assistance. We should be having that monthly. And then all the other things we're talking about, the moratoriums on evictions and foreclosures, the rent and mortgage freezes or cancellation, all of those things working together. But the number one thing for me right now is the data and getting that into the next relief bill, that guidance is there. both to ensure an equitable response in the public health response and in the economic recovery.
Thank you so much, Representative Pressley. We're going to come to you, Representative, and let me introduce the community leader who's going to be asking the question. Sean Tan is a member of the Coalition for Humane Rights of Los Angeles, CHIRLA. He has been since his sophomore year of high school, it's quite some time ago, advocating for the Federal DREAM Act. Sean, take it away.
Hello again. Thank you for having me today. I'm a DACA recipient and my siblings are also DACA recipients, one of whom is a nurse who is caring for critically ill patients as well as patients that have tested positive for the coronavirus, and my parents are undocumented. I think I'll start by saying that even before COVID-19, my family, my community, and I have been anxious and worried about the Supreme Court decision on DACA, which the next possible announcement is this Thursday. As many of you may know, DACA allows many individuals, including myself, to work, gain access to healthcare, to live without fear of deportation. Lately, I've been left with the question of how am I supposed to live and survive in this pandemic if DACA is taken away? As much as I know, the COVID-19 pandemic is exacerbating inequities that immigrants and communities of color face in our country. I think about my mom who doesn't have access to health insurance due to her status, but risks her health and life to work because if she doesn't, she loses her job and only source of income. Knowing these types of disparities, my fellow organizers at CHIRLA and I have also been raising emergency relief funds for our community members, such as garment workers who were left out of the federal COVID-19 relief package. We know that many people, such as car washers, farm workers, domestic household workers, day laborers, are left without relief during these challenging times. So I would like to ask this question to Representative Chu. How can we ensure that all people, regardless of status, are included in the next coronavirus relief package?
Well, thank you for telling your story so eloquently, Sean. You so clearly explained the situation that so many immigrants are facing. And this is an issue that I take to my heart. In fact, one of my priorities is making sure that immigrants are included in any of the COVID-19 relief packages. This virus does not discriminate, and our laws and policies should not either. Many immigrants are in the forefront of the crisis, helping to provide critical healthcare issues and ensuring that our supply chains remain in operation. And in fact, there was a report that showed that 200,000 DACA beneficiaries on the front lines of the COVID-19 pandemic, including 29,000 that are directly working in our healthcare system. And then there are the TPS, or temporary protected status holders from El Salvador, Honduras, and Haiti that are helping to support the nation as essential workers. And it's estimated that there are over 130,000 of them. But under the CARES Act and Families First, many of these essential workers did not have access to preventive care and treatment for COVID-19 related illness. This is so dangerous. Of course, it is dangerous for these immigrants, but to the public at large as they are providing critical services during the pandemic. And this pandemic can only be curbed if everyone has access to testing, treatment, and preventive services. And in addition to this, many legal immigrants have expiring work authorizations that they cannot renew in a timely manner because USCIS offices are closed. And that includes DACA and TPS holders, as well as others who may be in the country on non-immigrant visas. So that's why earlier this month, I introduced the Coronavirus Immigrant Families Protection Act. This legislation provides coverage of COVID-19 testing and vaccines under Medicaid to everyone, regardless of immigration status, and halts the implementation of the public charge rule so that immigrants are not worried about accessing benefits for COVID-19 related care. It also extends expiring work authorizations and immigrant statuses for the length of time they're issued for. And it allows immigrant taxpayers to access stimulus checks with individual taxpayer identification numbers, the ITINs. Look, they may not have a social security number, but these ITIN holders pay taxes just like everyone else, and they also deserve relief during this difficult time. All immigrants should have access to health care and receive the same benefits that we're sending to everyone else, especially during this crisis. We need to make sure that they can stay healthy, afford food, and pay rent. And together, we can overcome this pandemic.
Thank you, Representative Chu. Thank you, Sean. Let's move on to Jamisa Johnson-Greer, Policy Specialist with Michigan's Environmental Justice Coalition. Jamisa, you had a question.
So I am a native Detroiter, and let me just first start off by saying that MEJC is a proud member of the Climate Justice Alliance. And so right now, many people would say that we're here in crisis in Michigan and in Detroit in particular. And I would make the argument that Black, Brown, and Indigenous folks were already embroiled in crisis before COVID-19 began to sweep through the state. And we've been living through a lack of access to water because of water shutoffs, utility shutoffs, poor air quality, lack of access to healthcare, and so many other basic human needs. I think that COVID-19 has simply pulled the curtain back on some of our ugly secrets here. And I'd like to know if there's the possibility for something that looks like a people's bailout that would center all people regardless of immigration status, from farm workers to sanitation workers, and would it include a moratorium on water and utility shutoffs? And I'd also like to echo what Representative Pressley said about things not going back to normal, and the need to actually think about how we can transition to a better system for everyone. And I'll leave that question for anyone of the
Representative Pressley, you want to tackle that one?
Sure. I want to make sure I got all of it. So I associate myself with all of those comments. You know, you're speaking to all the things that the CPC and other members of our caucus, and particularly our chairs and leadership that are at the table, people like Barbara Lee, are at the table fighting for those things. I don't know ultimately what the language is. I'll have to say that. So, you know, there was Families First, there was a CARES Act. Now we're looking for a relief bill that will basically be like CARES Act Part B. And then after that, a fourth package that'll focus on infrastructure and recovery. You know, I personally think that we have to more broadly define infrastructure. You know, your most expensive bill is housing. So I think housing should be included in that. Alicia Johnson was on a call the other day and spoke about how caregiving, more people are having to do that, and that's an important part of our infrastructure as well in recovering from this, and that should be included. And certainly water. And I have to say that, you know, the drum banger on this issue has been Representative Tlaib of Michigan. And she has been able to bring so many colleagues along who might not have initially appreciated just how many people were still functioning without water and that shutoffs were still happening. And so how can you stop the spread of a virus that requires you're washing your hands if people don't actually have water? So I know that all of these issues that you just elevated are things that we're fighting for. I don't know where they'll land in this CARES Act Part B, but I do know that water specifically, broadband to address the digital divide has been named specifically when we're talking about the fourth package, which will center infrastructure and recovery. But I think the definition of infrastructure really needs to be more broadly defined, and that's what I'll be fighting for.
Thank you.
Representative Chu?
Well, let me say that the stay-at-home orders really shone a light on the issue of environmental inequality. As everybody's quarantined at home, people in communities of color where there are fewer green spaces on average and populations are more densely packed have had fewer options for moving around outdoors. These communities are also more likely to have less clean air, which creates health risks. And that's why I believe environmental justice has to be key and critical and essential as the U.S. recovers from the COVID-19 crisis. Today, communities of color have higher exposure to air pollution and are more often likely to live near landfills, hazardous waste sites, and other industrial facilities. They are more likely to suffer from lead poisoning and have more limited access to clean water. So today we do see a higher COVID-19 death rate of communities of color, but we have to recognize that all of that started with the health disparities engendered by these inequities in the living standards for communities of color, and it started a long, long time ago. And that's why I am an original co-sponsor of the Environmental Justice for All Act, which would direct the federal government to adopt a comprehensive approach to promoting environmental justice across all federal activities and establish an interagency working group on environmental justice and direct the agencies to develop and enact environmental justice strategies and do a bunch of other things such as require longer comment periods for the Environmental Policy Act and also have in-language materials on proposed projects. And of course, I am an original co-sponsor of the Green New Deal. What we must do is to make sure that workers are employed through the program through family sustaining wages with adequate family and medical leave, and that they have the quality of life that they so deserve. So right now, the COVID-19 pandemic is exposing the risk to minority communities who do not have clean air to breathe and clean water to drink. It's up to us to change this so that a zip code is no longer a determinant of your health.
Well said, Representative Chu. I want to go to our Congresswoman Barbara Lee as the final, and let me introduce People's Action Laura Martin from Nevada with the final question of the evening.
Cool, thank you. Representative Lee, I want to thank you for your leadership in protecting our democracy and voting rights. I live in North Las Vegas in Nevada in the congressional district held by your CBC colleague, Stephen Horsford. My organization, the Progressive Leadership Alliance of Nevada, we engage formerly incarcerated voters, new Americans, and tribal members in every election. We organize with frontline communities and directly impacted leaders to fight for policies that actually improve people's lives. We've won the right for tribes to have polling locations on their land regardless of population. We recently won automatic reenfranchisement, a multi-year fight that plan was engaged in. And we have a direct service immigration office that helps people become citizens and eventually new voters. I'm proud that for more than 25 years in Nevada, we have been a progressive force unapologetically demanding liberation for people who are purposely pushed out of the democratic process. And my question for you is, our Black and Brown communities are going to be the most impacted this election cycle. We need at least $4 billion to be included in this next emergency relief package to ensure that voters can safely exercise their right to vote while still protecting their health and well-being. What can you do to ensure we maintain access to the ballot box despite the impediments COVID-19 poses?
Hi, can you hear me?
Yes.
Okay, thank you. And I really appreciate that question because we are really facing a threat to our democracy in general. And we know that COVID-19 now has given Donald Trump and the Republicans and the right wing an opening to try to engage in more voter suppression. We saw this in Wisconsin, unacceptable. And so what we recognize is that what they are trying to do is to use this global pandemic to roll back our constitutional rights. And we've got to do everything to ensure that their efforts succeed. So a couple of things that we're doing in terms of making sure that we're putting the funding and the resources in for localities and states to ramp up their vote by mail efforts. We put in, we're requesting $500 million, the Progressive Caucus is, for vote by mail. In the prior bill, we got $400 million, but that was for election security grants. And that's okay, but election security grants go to the states, and the states can do whatever they decide to do. They may decide to do mail-in ballots, they may not. And so we've got to make sure that every state, well, first of all, that the federal government in the funding of these CARES packages includes the additional funding for get out to vote, for voter education, and for easy access to the ballot, because we know, to the ballot box, because we know that given what is taking place now, they're using this to try to suppress the vote further. And so the states are going to be very key in this. So I would urge you to work with the states just in terms of this first $400 million for election security grants. But we're going to try to get more money in. I think we estimated, I believe it was about $1.5 billion to have total mail-in ballots for everyone in this country. So this is a very precarious time. We're really at the brink. We can either go forward or backwards. And so I would encourage you to get with your states, get organized, and make sure that we know exactly what you need in your space and in your community so that we can advocate that for these bills. But we're really trying to get more money in for election security. Finally, let me just say, don't forget the census. It's been extended now, but we have got to make sure that everybody engages in filling out their census forms and getting them in, because we know that if you're not counted in, you're counted out. And the census determines not only political jurisdictions, but importantly, schools, roads, bridges, internet, access to broadband, healthcare, community health centers. And we have got to do that because we know that they're trying to suppress that effort also. And so just thank you guys again very much for this call. But just know that all of us, Congresswoman Pressley, Chu, all of the members are working so hard to make sure that this pandemic, first of all, that we get out of this together and that we don't go back to where we were as it relates to brown and black communities, and that
we're here and we're all in it together. I know that the relief package is being taken up this week, at least next.
We have health disparities programs that we have to fully fund. And so we have to come out of this stronger. And so working with you and organizing is going to be key to that. Thank you all again so much.
Thank you so much, Representative Lee. And as I was saying, the relief package is being considered this week. I know that the Congresswomen are busy in Washington to log off now. I want to thank Congresswoman Barbara Lee, Judy Chu, and Ayanna Pressley for your leadership, your fierce advocacy of Black and Brown communities in this critical time. Thank you so much. And a thank you to all the organizers and leaders who come from the community to tell us more about the problems, their own lives, their life story, and the solutions that they're working toward. Appreciate you all. All right, the final part of this call is really turning to Dorian Warren, who's the president of Center for Community Change. Hi, Dorian.
Hi, Aimee. Thank you.
We've laid out all the issues. We talked about problems. We talked about some really powerful solutions. How can we all get involved?
There are a few ways, but I want to say some thank yous first. So thanks to the powerful people on this call who shared your stories, to the Congresswomen, Congressmembers Chu, Pressley, and Lee. You are some of my personal sheroes, and I want to thank you directly for your leadership and your partnership in what is probably the most important fight of our lifetimes. Thanks to all the allies working together with us to address this crisis in the most inclusive way possible. And Aimee, thanks to you and She the People for moderating, and thanks to Liz Watson and the entire staff of the Congressional Progressive Caucus Center for bringing us all together and for fighting the good and just fight. So listen, I am struck in this moment by how often I see and hear these simple words. We are all in this together. And my heart wants to soar when I hear those words, because indeed this crisis speaks to the inescapable fact that our fates as human beings are all tied together. Our fates are linked together. They always have been and they always will be. We are all in this together. Now, these words are a direct repudiation of the right-wing ideology that insists that we are each on our own, that it's every person for themselves. It's an ideology and set of notions that reinforce the belief that by dividing, by distracting, by blaming people of color, by blaming Black folk, blaming immigrants, and anyone else that the other side can paint as the other, that some folks will be fine. And I'm here to say that's BS. And this is the moment to bury that harmful set of myths and ideology that literally harm and kill too many of us, and especially the most vulnerable. The unmistakable fact is that we are all really in this together. Now, when I hear those words, I also think we're all in this together. I'm also torn by the reality that too many of our folks, our friends, our family, our neighbors, our coworkers, are actually in this alone. And certainly, the impacts of both the health crisis and the economic catastrophe are falling disproportionately on the most vulnerable, on low-income people, on women, and particularly people of color, Black folks, Native and Indigenous folk, Asian folk, Latinx folks, immigrants, and especially women of color. So we are all in this together is at best an aspiration, not only for this moment, but for how we need to emerge from this crisis by getting serious about building a society and an economy in which all of us can survive and thrive, no exceptions. We need a bold, inclusive, and caring agenda for America, one that's grounded in racial justice, one that's grounded in gender justice, one that's grounded in economic justice. So I hope all of you watching are willing to join the fight. This fight is urgent, and we need you to call, we need you to email, we need you to text, we need you to tweet, we need you to Instagram, whatever you do, do it all, and contact your members of Congress and do it repeatedly. You can make a difference by telling Congress to go bolder and be more inclusive and stand up for justice. So if you need a place to plug in, you can text the letters BOLD, B-O-L-D, to 40649. Again, to help make a difference, you can text BOLD to 40649 and plug in wherever you can. Take action. We need you to stay engaged. Thanks again for all of you who tuned in to this important conversation. And please, please, please take action and then take action again. Love and solidarity to all of you, and back to you, Aimee.
I love that. I love that. Somewhere there is a slide that shows the Congressional Progressive Caucus vision for what our stimulus package should do to serve Black and Brown communities. If you've got that, show it. If not, I want to say, oh, beautiful. Here's what we want. We want to keep people on payroll. We want to keep people's money, cash payments, so that those are our community that are most effective are able to live and pay rent and take care of their families. We want a package that provides financial relief that's sufficient and includes everyone. We need to protect public health. Now is not the time to think small. Now is the time to expand access. And finally, we need to protect and defend elections. We heard it from our tremendous leadership that was our congresswomen that were on this call. We heard that vision expressed with the community leaders who were on the call. And I heard it, I saw it, I read it in the comments that you shared during this hour. I want to thank you so much, everyone, for joining us from across the country. I want to invite you to participate in the future CPCC events And I want to point to how you can get involved. Dorian laid it out, but you'll be able to stay plugged in the movement so that this tragedy can turn into opportunity for us to come together and demand true change. Have a great Monday night. Stay safe, stay healthy, and stay together.